Hi there, my name is Nwkoma. I'm one of the doctors here at Oakwood Surgery in Doncaster, South Yorkshire, UK. Today I'll be talking to you about how to examine your breast. Why do we need to do this? Breast cancer is one of the commonest cancers in women, and there's a lifetime risk of 1 in 8 women getting breast cancer. It's commoner in women who are over the age of 50, but younger women can get it, rarely men as well. So here in the NHS, women between the ages of 47 and 73 are invited to have regular mammograms, which is a special X-ray, and it is important that you attend these appointments if you receive an invitation. Why we do this is if we pick up a cancer early, the chances of getting a cure is actually high. On the other hand, if it's picked up late, the chances of getting a cure are quite slim. So what are the symptoms of breast cancer, you may ask? So the first one to talk about is breast lump. Now, not every breast lump is a breast cancer, but if you notice one that lasts beyond the time of your period, you should have it checked out. So next to mention is the change in shape and size. Again, this can vary from month to month, but if it is a significant change in size and shape, or one that is continuing past the time of your period, you need to get this checked out. Next is the skin. So if you notice changes like the skin becoming, forming a dimple that wasn't there before, or like the skin of a chicken, or having puckered appearance on it, or even things like eczema that wasn't there before, especially if it's near the nipple, these need to be checked out. So make sure you make an appointment to see your doctor. Now, with regards to the nipple, so breast cancer can change the appearance of the nipple. So it may start to turn inwards, or like people say, get inverted. If this happens, it needs to be checked out. Also, if you start noticing abnormal fluids coming from your nipple, especially if it contains some blood, what's checking out? Yeah? Okay, so next we're going to talk about pain. Breast pain is very common in women, very common. The thing is, with breast cancer, breast pain is very uncommon. However, if it's only on one side and it's lasting long, it needs to be checked out. Okay, so in the armpit, we've got some lymph glands. Sometimes if cancer spreads to the lymph glands, it can make them more obvious. So if you notice any lumps in your armpit that were not there before, these need to be checked out. So what does breast examination involve? So examining your breast is simply trying to get familiar with your breast, how it feels, how it looks, so that if there's anything abnormal, you can pick it up. So the guidelines don't suggest how often you should do this, but I'm going to show you something that I found that works and which I've taught my patients. Okay, so how about choosing a date that you can remember? An example is your birthday. So say you were born on the 25th of December, you can examine your breast on the 25th of every month. That way, you can catch your breast, whether you're in cycle or outside your menstrual cycle for those who are still menstruating, or within a month, any changes within a month, you can pick them up easily. So first thing to do is to stand in front of a mirror, and then have a look. You're trying to find out what the shape, the size of your breasts are like, yeah? So stand in front, watching, and then while you're doing that, you gently raise both arms, like I'll do just now. Then all the way up, you're watching for any change in size and shape. Then gently bring your arms down again. Then put your arms on your waistline and squeeze tight. Now what that does is it tightens the muscles on your chest, underneath the breast, and if there's any changes at all, they should show up at that point. So the next thing would be to examine your underarm or your armpit. So this is quite easy. One arm raised, one arm in your armpit, bring it down, just feel. Again, if you notice any lumps that weren't there before, you need to let your doctor know. Swap over to the other side, yeah? So after this, next will be to examine your breast on the bed so that you have the support of the bed and the support of your chest wall to examine that. So Annie is going to help me do that. But before we move on to that, just to say, imagine an imaginary crossing line in the middle of your breast so that you can imagine your breast divided into 4 quarters. Then examining one quarter after the other until you've examined all, and then examine the nipple. And I'm going to show you that in a minute. So using imaginary lines in your head, divide the breast into 4 quarters, like that. Then using the flat of your hand, so the left hand for examining the right breast, examine each quarter, pressing down into the breast tissue to try and find how it feels. A bit like that. One quarter at a time. Remembering to press deep, looking for anything that feels abnormal. Finally, examine the area under the nipple the same way. Just a reminder that what you're looking for are new lumps, changes to the skin, or changes to the nipple. Your doctor is very skilled at identifying breast problems that need to be taken further. So if after watching this video or examining yourself you find anything at all that is worrying, please make an arrangement to see your doctor. Thank you for watching.